common type of gynecologic cancer diagnosed is endometrial cancer by far. The typical age range for that is above 60, so generally an older population of patients. Then ovarian cancer, as you mentioned, approximately 20,000 women per year will be diagnosed with ovarian cancer. That occurs in slightly younger patients, so on average 50 to 60-year-old women. And then the third most common is cervical cancer, which includes about 12,000 new diagnoses per year, women diagnosed with cervical cancer per year. And that can happen in younger patients, so anyone between the ages of 30 to 50 is most common. If you fall within that age range, I'd encourage you to talk with your doctor. So if you see an OB/GYN regularly, that's the best doctor to talk to about these screening procedures. But if it's a primary care doctor, ask them about that. They should be bringing it up as well. It's recommended on average between every 3 and 5 years, and exactly what that screening is will depend on your particular situation. So I'd, again, recommend discussing it with your doctor. And that can involve, as I mentioned, both brushings of the cervix itself to look for abnormal cells, and then also new tests to detect the presence of HPV virus. One of the most well-established screening procedures of all cancers is cervical cancer screening. And that involves a pelvic exam with a pap smear and looking for abnormal cells on the cervix, sometimes also with HPV testing or human papillomavirus testing. That's recommended for patients between the ages of 21 to 65. It does involve a pelvic exam, which for many women can be uncomfortable. That's really important both to be able to feel the cervix, to see the cervix, and to take those samples that we can look for abnormal cells or the HPV virus. It is extremely effective, however, at detecting early stage cervical cancer and even pre-invasive cancerous changes to be able to increase the chances of cure from that cancer. So very important and effective.